Hello, my name is Joan Williams, and my quantitative critique is on Massey's report on postoperative ileus. Is it time to cease a long-standing nursing tradition? My apologies. And this report was put out in 2012. So the significance of the problem. Trying to determine the reliability of auscultating for the return of bowel sound, if that is an indication of the end of POI. So I'll go in detail a little bit about what is POI. POI is indicative of gastrointestinal dysfunction, resulting in either a decrease or an absence of gastrointestinal motility, and this is commonly occurs in patients who have abdominal surgery. So the study had two aims. There was a primary and a secondary. In the primary aim, differences were examined in the duration of POI as indicated by time of passage of first flatus in days between two groups of patients recovering from abdominal surgery. The secondary tried to determine if there was a correlation between the time measured in days of bowels when first auscultated with the time of passage of the first flatus, indicating an end of POI. So the significance in nursing. Nurses use the nursing process to take care of patients. So by implementing an evidence-based health care practice in their care when they're providing care to their patients, this will promote appropriate outcomes. With the use of more reliable methods, nurses will be able to accurately assess the end of POI. If the duration is not accurately assessed, this can impact hospital stay, the cost, recovery time. So it is a very key assessment that is necessary. There was no theoretical framework for this or a conceptual model. However, Massey modeled his study on other studies that was mentioned in his study. So there were two variables. You had the dependent and the independent variable. The independent variable was the rocking chair intervention. The dependent variable was the return of bowel sound and the first passage of flatus. The intervention used was the rocking chair. It was used in patients after abdominal surgery was completed. The patients had to ambulate first day after surgery, and ambulation continued until the first passage of flatus, or the return of bowel sounds returned. They had to get out of bed, get in a rocking chair for the experimental group, and sit for about 10 to 20 minutes, at least an hour per day. For the sample, there were 66 patients. 32 of them participated in the control group, which was considered the non-rocking group, which means they received standard nursing care without participating in rocking chairs. And you had 34 participants who participated in the experimental group. These participated in the rocking chair intervention. For the inclusion criteria, patients had to be able to speak English. They had to be cognitively intact, be able to ambulate, to sit in a chair or a rocking chair. They had to have had some digestive cancer and was going to undergo surgery, and also had the ability to receive anesthesia via IV or epidural. There was no inclusion criteria, but it is implied in the study. Approval was obtained from the University of Texas MD Anderson Cancer Center Institutional Review Board before the study began. The clients who were participating in the study, they gave their informed consent, and the process was explained to them before the commencement of the study. So the participants in the study were randomly assigned to either the experimental group, as I mentioned before, or a control group. The experimental group was the group that participated in the rocking chair intervention. The primary investigator was responsible for the patient assessment. They did that at the same time every morning after surgery. They auscultated for bowel sounds and for the passage of the first flatus. The patient's medical records were reviewed daily after surgery. Auscultation of bowel sounds was done for 5 minutes in each quadrant by the investigator, even though the nurses and the doctors did carry out this function. And all data was, all data was documented on a study sheet. So the results yielded no statistical differences in the time of the first bowel sound between the rocking and the non-rocking group. Also, there was no correlation between the time of first flatus and the return of bowel sounds combined. Massey's findings support the evidence that the auscultatory methods were a likely poor indication of POI resolution. There were no limitations identified in the study. However, the researcher suggested that further research should be done. Limitations not discussed were the demographic data, which was, example, the age, gender, ethnicity. The small sample size was could not be generalized beyond the participants, and the extraneous variable, which was not mentioned, could have threatened the outcome or validity of the study. And this could have been a patient who was NPO, a patient who got introduced to early nutrition, or a patient on some kind of analgesic for pain. This was not considered in the study. The applicability of the study nursing. Exercise then caution when using auscultatory measures to determine POI resolution is important, because if the correct assessments are not made, then the care plan is not going to be effective for that patient. Passage of first flatus, elimination of abdominal distension, nausea, vomiting, and diet intolerance are indicators that appear to be more reliable in determining the end of POI. In conclusion, the standard clinical practice of auscultating the return of bowel sounds is challenged and should be used cautiously in nursing. There are no significant differences between the groups that participated in the rocking chair intervention and the group that did not. More research is also warranted. In practice, nurses should use an array of assessments to determine the end of POI. Thank you very much.